I'm Vadim Pugachev, Chief Technology Officer of Biocom Technologies. Our company is a well-known leader in research and development of innovative products and technologies, including software and hardware for health and fitness assessment, physiological research, and biofeedback based on a new science called heart rate variability. Today we will be demonstrating our new professional product called Heart Rhythm Scanner. This product is being used by more than 50 clinical research and educational institutions in the USA and around the world, such as A.T. Still University, East Carolina University, Royal University Hospital, Los Alamos National Laboratory, Stanford University, North Carolina State University, and many others. Many professionals use the heart rhythm scanner in their daily practice to enhance their health assessment techniques and optimize their treatment procedures, while others may prefer to use heart rhythm scanner to obtain more comprehensive assessment of the autonomic nervous system using its built-in testing capabilities, which are much wider, more powerful, and extremely accurate. Now we will show you a new heart rhythm scanner test called the Cardiovascular Health Assessment. This test records patient's heart rhythm while patient is performing a stand-up maneuver. It takes about 11 minutes to complete this test. Special heart rhythm variability analysis is applied to obtain information about how fast and adequately patient's cardiovascular system reacts to a small physical challenge, as well as how well it adapts to new functional demands. The healthier the cardiovascular system is, the quicker and more efficiently this adaptation occurs. By performing this test regularly, you may get important information about tendencies in patient's cardiovascular condition, whether it remains good, improving, or regressing. This test may be utilized by many healthcare professionals, ranging from general health practitioners to chiropractors, naturopaths, nutritionists, weight loss counselors, physical therapists, and many more. This test must be performed while patient sits in a chair in relaxed, slightly reclined position. The patient should limit body movements, remain silent, and have a neutral state of mind. It is recommended not to take any food, caffeine, beverages, or do exercise for at least 2 hours prior to this test. To record patient heart rhythm, we use Biocom 4000 ECG recorder connected to PC with USB cable. This test must be performed while patient sits in a chair in a relaxed, slightly reclined position. The patient should limit body movements, remain silent, and have a neutral state of mind. It is recommended not to take any food, caffeine, beverages, or do exercise for at least 2 hours prior to the test. To record patient's heart rhythm, we use Biocom 4000 ECG recorder with 2 ECG electrodes embedded in it and a third electrode on a separate cable. First of all, we need to put 2 wrist bands, elastic wristbands, on patient's wrists. Then we need to put ECG device on left wrist underneath elastic wristband, and then put electrode on right wrist underneath wristband. The device is connected to PC with the USB cable. Now we're ready to run the test. First, we open the patient's record or create a new one if this is a new patient. Then we choose cardiovascular health test and start it. The software shows live ECG signal make sure that we're getting good signal, right information, and make sure that all heartbeats are detected on ECG. Then also we see a regular heart rate on this graph and scatter graph. Once we make sure that we good quality data, we can begin our test by clicking record button. During the test, the software shows the progress of the test, indicating elapsed time and time left. The baseline recording lasts for 5 minutes, after which patient will have to stand up by command. Now baseline recording is over. We direct patient to slowly stand up and click OK. Patient has to remain standing for another 6 minutes until test is over. This is the cardiovascular health assessment report. It shows patient personal information, test data quality information to make sure that we have good quality of recorded data, and we also have heart rate graph indicating the full history of heart rate during 11 minutes of the test, 2 power spectrums representing information during baseline and while standing. The key part of the report is a cardiovascular assessment diagram used to interpret current condition of the cardiovascular function, its tolerance and adaptation capabilities. There are 9 main types of this condition depending on how well the cardiovascular system is reacting to stand up and adapting to new position. This test indicates enhanced cardiovascular tolerance, which means that cardiovascular system of the patient is very capable of properly reacting to stand-up maneuver, and a fairly good adaptation capability, indicating that after standing up and changing position, cardiovascular system properly adapts to a new position compared to its baseline recording. Below the diagram we see a test summary indicating prevailing baseline heart rhythm. In this case it's normal cardia, which means resting heart rate is within normal range. Heart rhythm disturbances indicating whether we recorded occasional or regular ectopic heartbeats in patient, and cardiovascular functional condition, which is a verbal interpretation of the test results indicated in this diagram. Below that we see test recommendations showing some advices to the patient based on current test results. This was a presentation of the cardiovascular health assessment test. Next time we will show you how to use the battery reflex sensitivity assessment test. Thank you for watching this video, and we'll see you next time.